Welcome to Healthcare Authority's Module 1 training on Medicaid suspension and enrollment strategies for Medicaid. The topics for this training will include the background on Apple Health Medicaid suspension, what suspension process looks like, the enrollment process, a few ideas to consider, best practices, and finally, resources available to you. Background. What does it mean to suspend Apple Health? Suspension basically means that an individual on Apple Health has had their full scope healthcare coverage reduced while institutionalized. When the individual becomes incarcerated, their coverage gets suspended, which then limits their coverage. Once the individual is released from incarceration, their healthcare coverage returns to full scope. This is all done in the background without having the individual's healthcare coverage come to a complete stop and without the individual having to go through the process of reapplying to get their healthcare coverage reopened. What started this process? This stemmed from Washington's legislature interest in serving mentally ill offenders from as far back as 2005 with House Bill 1290. With the passage of the Affordable Care Act and Medicaid expansion in Washington state, the ability to potentially serve all offenders was made possible. Senate Bill 6430 expanded the work that House Bill 1290 started and directs the agency to suspend Medicaid coverage rather than terminate for individuals who are incarcerated or institutionalized. Studies have shown that suspending coverage for individuals who are incarcerated rather than terminating their coverage will provide stability of care for offenders once released. Other requirements of the bill for individuals that do not have health coverage is to enroll them in Apple Health while incarcerated and suspend that coverage so it is available at release. This facilitates continuity of care and makes care coordination prior to the individual's release more manageable for a smooth transition. The Healthcare Authority began the suspension process in July of 2017. This is done behind the scenes in the Medicaid payment system. Once incarcerated, the individual's coverage is suspended. While suspended, coverage is limited to inpatient services only. Once the individual is released, coverage is automatically reinstated to full scope coverage. Eligibility for full scope Apple Health depends on the living arrangements of the individual. In general, it follows the rule of where you lay your head, which means, in short, that individuals living in their home are eligible. Those in a public institution are not. Individuals participating in electronic home monitoring are generally eligible. A couple of common questions we receive other than straight incarceration is if individuals on work release have their health care coverage suspended or not. Most county work release facilities are not qualified, but most state-operated Department of Corrections work release facilities do. As mentioned before, the goal of the suspension process is for individuals incarcerated or institutionalized and being treated can continue to receive treatment after they are released. With their continued engagement in treatment, the chances of individuals returning may be reduced. When treatment continues to individuals after they are released from incarceration or institutionalized, some of the barriers, such as depression, can continue to be treated without a pause. The next few slides will have more information regarding the health of these individuals. As you can see here, 78% of incarcerated individuals have behavioral health treatment needs and 61% have substance use disorders. The actual numbers are not important, but the high percentages are telling. Some of the chronic medical conditions in the U.S. include overweight, arthritis, and hepatitis. For more information, the link is included on this slide. As mentioned earlier, Studies done on incarcerated individuals show that access to treatment and medical care is important, and even more so when individuals are released. Suspension process. As of July of 2017, individuals who are incarcerated will not have their health care coverage stop. While incarcerated, if the individual has health care coverage, their full scope care will be switched to limited care. If the individual does not have health care coverage, facilities can now get them enrolled into health care and have it suspended prior to their release. Release planning for the individual will start the care coordination process, and once the individual is released from being incarcerated, their limited care will switch back to having full scope care to assure treatment continues. The suspension process is done behind the scenes. Updates for these who are incarcerated and released can be updated overnight. Those who have access to view the individual in the agency's eligibility systems will only see the individual as active. Suspension only shows in the Medicaid payment system. Here is an example of what the suspension process looks like. An individual is taken into custody 6:00 p.m. Friday night. Saturday at 12 a.m., Healthcare Authority receives the statewide jail bookings data and full scope coverage is suspended. Saturday night at 5 p.m., the individual is released. Sunday at 12 a.m., Healthcare Authority receives the statewide jail booking data and full scope coverage is reinstated. Enrollment process. The Washington Administration Code allows correctional facilities to enroll individuals in Apple healthcare coverage. It is possible for a facility to sign for an individual when using Apple Health to cover an inpatient hospitalization. Offenders releasing to the community should, whenever possible, have an opportunity to sign their application, thus consenting to getting Apple Health. The link www.wahealthplanfinder.org is the website address where individuals 19 to 64 can be enrolled for Apple Health coverage. It can be done as quick as 10 to 15 minutes with real-time eligibility results. For facilities who have staff available to enroll individuals, online training is available to become a certified Healthcare Authority volunteer assister. Things to consider. Some of the facilities who have started the suspension process have found it was helpful for them to have discussions on what resources they have available to create a sustainable process. That may entail working with local partners to do that enrollment or assist with screening and prioritization. Best practices. What facilities must decide is, do we know who in our community enroll people in Apple Health, such as navigators, in-person assisters, local DSHS offices? Can we call them to verify if the individual already may have coverage if we cannot determine this by talking to the individual? Also, do we have staff available in our facility who can take the Healthcare Authority online training and become a volunteer assister to do your own enrollment process and inquiries? What is possible in my facility? If your facility decides you can have a staff member do the enrollment process, what would that process look like? Do you know of other facilities who have been involved in the enrollment process who you can contact to provide you some ideas on things to consider? If your facility decides to have a third party assist you with the enrollment process, be sure to keep the listed tasks in mind. If your facility finds you have a staff member who can become a certified Healthcare Authority volunteer assister, the Click Here link will take you to our website to learn more about the training process and contact information about it if you have questions. Each facility has their own needs and operation processes. Some questions for you to consider may assist you in deciding what is best for your staff. Some of the treatment that incarcerated individuals may need could be what helps you decide how soon they should be enrolled in healthcare coverage as soon as they are released. If you find you do not have the resources available to do your own enrollment process or would like to know more about how to get started, Healthcare Authority will have dedicated staff to assist you as you get started. Please refer to the email box listed at the end of this presentation. Healthcare Authority has designated staff to assist with enrollment and troubleshooting enrollment issues on a limited basis. Resources. For general information on Apple Health eligibility, we have our Healthcare Authority training and education resources as the first link. And for more information on how your facility can have your own staff dedicated to assist in the enrollment process or inquiries, please click on the link under Volunteer Assister. For more information about suspension, Healthcare Authority has a page dedicated to Medicaid suspension. Please be sure to click on the third bullet. And for more information about the Washington Health Plan Finder and the staff who support that system, please click on the link under the Washington Health Benefit Exchange. In the next few months, we will have Module 2 that will talk about funding sources, and soon after, Module 3 on care coordination. Please contact us at the email address listed here if you have questions to help you get started or anything related to Medicaid suspension. Thank you.